नमस्कार, मैं डॉक्टर हीरक सिंह, कंसल्टेंट फिजिशियन सिनर्जी हॉस्पिटल देहरादून से। आज मैं बहुत ही इंपॉर्टेंट टॉपिक आप लोगों के सामने लाया हूँ। कुछ ऐसी बातें जो शायद आप लोगों को नहीं पता होंगी। फर्स्ट ऑफ ऑल, आई वुड लाइक टू टॉक अबाउट लेटेस्ट अपडेट्स इन हाइपरटेंशन। अभी व्हेन वी कम टू लेटेस्ट अपडेट, इट मींस कि डब्ल्यूएचओ का जो लेटेस्ट डाटा है दैट सजेस्ट अस दैट 23% ऑफ द टोटल डेथ इन इंडिया are due to non-communicable diseases. This is a very great burden, 63%. And when we come to non-communicable disease, the major chunk of this comes from cardiovascular diseases. And when we further narrow down our research, then we came to know that in CVD, the most common risk factor is hypertension. When we see in the age group of 40 to 69 years, we get 45% of these people in this age group are having cardiovascular diseases. And the major risk factor again for it is hypertension. So what are the problems that we are facing when it comes to hypertension? First one is the low awareness in the people. People do not know what is hypertension, how it can be dangerous, and many complications of it, how to treat it, how to follow up, everything like that. Second thing is proper care. They do not get proper care for if they get diagnosed with hypertension. They do not know what further to do, what is the care that is to be needed. And last but not the least, if once diagnosed with hypertension, they'll get cured with some medication or the other. But again, after that, there'll be loss of follow up. They'll not follow it because they'll say our blood pressure has come down to normal and we do not need medication. But these all are wrong myths, should be controlled, should be people should be aware about this. In India, the prevalence of hypertension for the past 30 years have been increasing. And if we compare the data 30 years back to now, more than 10% increase is seen both the genders, male and female. Obviously, male are more prone for this disease due to maybe modifiable, non-modifiable risk factors. They contribute to these all non-communicable diseases. 50% of the people who are having any of these non-communicable diseases, say hypertension, do not know about their condition. And more than 50% of the people who are diagnosed with hypertension, they are knowing that they are having hypertension, but they do not go to seek a treatment. Even if they go to a doctor, they will not follow the advice. It means 50% are having the condition. It means 50% do not know whether they are having hypertension or not. Those who are knowing we are having hypertension, they are not getting cured. More than 50% of them are not getting treatment, proper treatment for that. This contributes to the complications of hypertension and mortality due to these cardiovascular diseases. Latest updates tells us that different new guidelines are there, like AHA 2020. They suggest the type 1 hypertension in stage 1. जो early stages में अगर हम patients को पकड़ लेते हैं hypertension के साथ, even who are having no risk factors for cardiovascular diseases, उनको हम 3 to 6 months के लिए we put them on conservative lifestyle modification. If they get cured on that, we continue this for further duration with regular follow up, so that even on lifestyle modification, if they develop hypertension, if the pressures are peaking, we should introduce medication. And if within 3 to 6 months of time we're not able to achieve the desired targets, we should start the treatment. During the time of COVID, we have seen the role of metoprolol that has decreased lung infiltration and increased respiratory function in such patients with COVID ARDS. Lower targets of blood pressures have been advocated in many studies. If we are able to get lower systolic blood pressures, like from 130 to target systolic blood pressure of 110, then better results have been seen in many studies. All in all, if we want to decrease the burden, both mortality as well as mortality that has been contributed due to hypertension, we need to be aware about the situation. We need to know what is it. Hypertension means just increase in the BP. There can be several causes for it, and majority of the time it is essential. That means idiopathic. So once we are diagnosed with hypertension, it's a prime duty to go to the nearest consultant, see to things which can lower our blood pressures, whether it is due to just anxiety event or it is due to a pathological event that is going on in the body. First, a proper diagnosis of hypertension. Secondly, a proper evaluation of organ involvement. And lastly, a good medical management is required for this dreaded disease, which can further contribute to huge mortality load to a community. Thank you. It was all for today's session, and have a nice day.